Uh, Thank you, Susan. And I was hoping that the dynamics of you assuming the role as my big sister wouldn't come out in this professional setting, but I should know better. Yeah. So, but thank you very much for the opportunity to be with you all in community. As you may recall, I was with you week one, and I regret I was unable to travel with you on the modules in between weeks one and five. But um, I've been in other places, not physically, but in other public health spaces. So I was unable to be with you all. I do want to revisit what Susan mentioned briefly. I am not a presenter. Um, I work as a facilitator, which for me as a facilitator, my task is to show the wisdom of the group. So the group coming together can accomplish its goals, and for thought partners to come together and share their ideas and participate and engage in a good way where the people's wisdom comes out. Um, so what I'm going to share with you is not my particular wisdom because I have very little wisdom, but based on the journeys I've been on since the past 4 months working with different organizations, I'm going to share with you my lessons learned over the 4 months working with small local nonprofits in the San Francisco Bay Area where I'm from. I'm actually, I don't mean to politicize things, but I'm just absolutely thrilled that the vice presidential um, uh, nominee is from Oakland. I mean, that's the closest I'm ever going to get to being politically connected because I actually know people that know her, and just, you know, I don't have that kind of access. So I'm just thrilled. Wow, someone from Oakland, and woman of color, half African American and half Asian American. But okay, well, we'll talk about that later. Um, and some of the conversations I've had with larger national organizations like the American Cancer Society, Habitat for Humanity, um, uh, the American Medical Association, how they're all dealing with these issues that we're currently experiencing, and some of the work I'm doing at federal agencies for the Centers for Disease Control, National Institutes of Health. I'm just going to share with you what I've learned over the past, how long has it been since we've been in shelter in place? That's kind of my demarcation point. It's been about a little bit more than 4 months. I'm kind of losing track of time, but I think about that amount of time. So that's what I'll be sharing with you. And just remind you, the reason why we're all gathered, that you all choose to be here as health leaders, is to learn about data, develop skills, exchange tools with one another, develop strategies so we can all be effective leaders in cancer and health advocacy um, in the Asian American, Native Hawaiian, Pacific Islander, and the other communities we're in solidarity with. So I just want to remind us that that's what these conversations are about. And just to quickly also, because this is a refresher for me, uh, module one, you were talking about disparities. I was there when Susan gave you the overview. You've heard from Anton about social media and how social media works in the different platforms and vehicles. Um, you heard about, with Camille, about commercial tobacco use, and tobacco is an incredible vehicle to do a lot of great work. That's how I met Reverend Ora, was doing work in Minnesota cross-culturally with communities together, addressing the predatory tactics and exploitation of the tobacco industry. I understand you also heard from Beverly or Dr. Gore, Texas specific data. The reason why I want to acknowledge Beverly is the first time I met her, maybe 10, 12 years ago, if that's right, Susan, she looked familiar to me. And I couldn't figure out why this health advocate, the Chinese American woman from Texas, looked familiar to me in the San Francisco Bay Area. And then I learned that her brother has been a famous newscaster in the San Francisco Bay Area for a long, long time. So I thought there was some sort of family resemblance, but for years I've been looking at Rick Kwan, who's her brother, over the years as a newscaster. So I'm sorry, that was a completely irrelevant tangent I just wanted to share with you all. That actually brings me great joy and delight. And then I understand you heard from Council Member 2 about her personal experience dealing with cancer. And then you heard from Lisa talking about the census and her personal journey as an advocate. So I'm hoping that you will take all those discussions that you've had, all the community or updates or highlights on the different organizations that are on this call, and that you'll kind of bring that all together in the conversation I want to have with you. That's my goal. Okay, so I'm gonna hop over now and share screen. And the only reason why I don't like sharing screen is because, as you probably all know, their use of this platform, you can't see folks. So I may pop back in between stopping sharing screen at the risk of making you all feel dizzy. I did recommend to your hosts that we should send everyone Dramamine because when I present, I'm always switching things around and such, so I don't want anyone to get motion sickness. So it's not you, it's me, okay? I will own that, I will own that. So. Can you, so to test your reactions or your comfort, okay, thumbs are already going up. I was just gonna ask if you could hit your thumbs up to let me know if you can see the shared screen. Okay, all right. So I would like to talk to you about moving our organizations and communities forward in this new cultural, economic, and social COVID-19 environment. Things are very different right now. I think, to say the least, for us as leaders, we need to take a step back and just kind of soak in all what's going on around us. Because I believe what's happening in this current environment, as we talk about this new cultural, economic, and social environment, we are looking at the intersection of three major events going on. We're looking at the COVID-19 pandemic. We're looking at the racial justice movement. And I believe we're looking at this very difficult economic times. And I know I'm not an economist, and I know there's some debate whether it's a recession or depression, what we may or may not head into, but we are heading into the unknown economically. And I think we just need to recognize this as we navigate our work, because it creates the very unique time convergence and intersection of all these things coming together. But I do want to mention a couple things just to affirm that we're all in the same place. COVID-19, the pandemic, has been a clear illustration in a very limited amount of time about health inequities. The unfortunate death killing of Mr. Floyd illustrates the inequities that are in a lot of our systems. And what's currently happening economically and the disproportionate impact on certain communities is also something that I think is starting a lot of different conversations and a lot of different organizing of groups. But I do just want to mention, and this may seem very intuitive to you, but I just want to announce it to the group. The disproportional impact of economic problems on certain communities is nothing new. Unfortunately, the death of Mr. Floyd and the systemic bias of some of our institutions is not new. And the pandemic affecting different communities that are more vulnerable, that is not new. So what I want to be really clear is, for us as health advocates, the discussions that I've been privy to for a lot of different health leaders is that what is new is that these things are all intersecting at a particular time, and there's an opportunity to potentially have discussions in a very defined period. That's what's new. And what I'm going to ask you to think about is, because I know that we are all of us on this call are in different journeys or in different places with our beliefs about politics and race and economics and disparities. We're all in different places. I just encourage you to think that maybe there's some things that I'm presenting or I share with you, or some things that are brought up on the call by other people that may not be your experience and that may not be your view, but we hear that and we receive that because then that is what someone else is experiencing. And I believe as health advocates, as multicultural, multi-ethnic health advocates, we need to not hunker down and shut other people out. There's got to be a greater, more engaged, inclusive conversation. So I'm hoping that what we'll cover today will have you reflect as health leaders, because there's different perspectives and different opinions. And what I'm going to try to cover in my, I believe my 40-minute and my 30-minute two time spaces for this call these are some of the discussions I'm having with some organizations now on an ongoing regular basis. So there can be these, what I call courageous conversations taking place. So this is just meant to be just a quick exposure. So I just want to talk a little bit about the impact of COVID-19 and to recognize just in general that we are complex, multicultural people with different cultural identities. And we need to be aware of these different identities that we have and our communities have because they are indicators of health. And they are very big indicators of health. And the ones I want to focus on right now are primarily racial group membership and socioeconomic status. Those seem to be very, very, very large indicators of health. And I'm sure if you recall back to what Susan was mentioning on module 1, you could see that among race and ethnicity, the different rates of prevalence, types of cancer diagnosis for different Asian American, Native Hawaiian, Pacific Islander groups, as well as other racial groups, that there's a lot of variations based on these different kinds of cultural identities we have. And I wasn't privy to what Beverly or Dr. Gore presented, but I'm sure some of these issues came out, or some of these dynamics came out in terms of what's going on in Texas. So just simply put, I think what we all need to recognize is that all these indicators relate to social determinants of health. And social determinants of health have a profound impact on your health outcomes. So for example, when I just did some very, very quick research, and this is probably, I'm hoping this is not new information to folks, but in Texas, the University of Texas in 2019 did a study on zip codes, and they determined that life expectancy in Texas varied by 30 years based on your zip code. So that is an indicator of social determinants of health, that where you live, the environment that you live in, your access to health care, your economic situation, your education situation, your housing, all these different kinds of things contribute to your health outcomes. And that is absolutely mind-boggling, folks. Absolutely mind-boggling that ranges by 30 years in Texas. 30 years. And one specific piece of information that I gleaned was that the life expectancy of a white non-Hispanic person is 5.9 years longer than Blacks in Texas. So I think that really serves as an incredible indicator about social determinants of health, and your overall lifespan is affected by your race and by your zip code. And zip code is primarily socioeconomic status. These are things that we need to be aware of as health advocates that frame the very conversations that we are engaged in. And the reason why I also put this up here is, as we talk about, well, the things that I'm going to talk about in terms of equity and health, I think we need to recognize, us as individual health leaders, we all have these different cultural identities that affect how we view the world. And I wish we had more time so we could explore these things and talk about these things. But, and this is not a complete list of the complexity of the different cultural identities that we all have. Immigration status is also a big indicator, and gender, not necessarily gender, but gender identity, how people identify in terms of the continuum of gender, also has a big outcomes and such. But I just wanted to have you think about this, that we're complex people with cultural identities, and some of these cultural identities or memberships determine what kind of health outcomes that we have. So speaking of COVID, I want to share a quick report that came out from the NAACP. And the reason why I'm sharing this is because the NAACP is not a health organization. They are a civil rights organization, the oldest civil rights organization in the United States. And they came out with this report this year about equity implications of the coronavirus outbreak in the United States. And I just want to share with you just three of the outcomes they reported. Not outcomes, excuse me, implications. They shared, the top three they shared: racism and stigmatization have increased overall with COVID-19 towards particular communities, particularly Black and Brown communities. But the NAACP, which is historically an African-American Black organization, indicates that the stigmatization is particularly towards Asian and the Asian American population. So something for us to be mindful of. 2, certain populations face differential exposure and extensive corresponding implications. I've often heard people say that the unique thing about COVID-19, the virus, is that it doesn't discriminate. It infects everybody. And I think, yes, that's true, but certain communities are more vulnerable, are more likely to be infected because of their exposure. And as the report says here, the corresponding implications of where they live. For example, people living in multi-families in single room households, or multiple generations in particular living situations, particular neighborhoods, the built environment lends itself. People that have to take public transportation, all these different kinds of things. Yes, perhaps the virus doesn't discriminate, but it's more likely to be found. It's more likely to find a home in or a place in communities where they are more at risk. So I do want to make sure that we do acknowledge that. And then third, frontline workers face tough choices amid differential health and economic risks impacts. Some folks don't have a choice, right? Some folks have to work. Some folks cannot work from home. And to share on a personal level, I had a big aha in terms of the privilege I enjoy. My wife and I are both working at home. I'm responsible for my mother, elderly mother. My wife is responsible for her elderly mother. So in the beginning of the pandemic, we were very careful about exposure. I like to think we're still careful about exposure, but to be honest, I will go out shopping now where I wasn't before, because I did not want to risk any kind of community spread and getting my mother or my mother-in-law ill. So we decided to do shopping through a service. And so we did our first order, and the person that was delivering our groceries couldn't find our house. So they texted us, and I met the person out on our driveway. And the driver that was doing our grocery shopping was a young woman of color with 3 small kids in the back seat. So that gave me a moment to reflect and pause. I just want to share with you in the spirit of transparency that I'm in a privileged perspective where I have the economic means to have someone else to shop for me. But that's someone that is shopping for me that is more economically vulnerable should not necessarily be in that situation, to say the least. And it just gave me pause for reflection and such. So I just wanted to share that with you. So if you think about that, think about these implications are huge coming from a civil rights organization. And the reason why I'm sharing this is because I want to frame this more than just a public health crisis. There are a lot of other kinds of implications going on. So let me share with you. For us to think of COVID-19 as Asian Americans and Native Hawaiian Pacific Islanders, there is strong anti-Asian sentiment tied to COVID-19. This is the vacuum that we're working in, as it's referred to as the China virus, as it's as it has been referred to as Kung flu. This is feeding into this anti-Asian sentiment that's taking place. And it feeds into xenophobia, the fear of new groups of people, the fear of immigrants, the fear of people that are not known, fear of people that are different. And it's led to a rise of anti-Asian violence and racism and discrimination. The Pew Research Center this year did a study, and they had found that 4 out of 10 adults find it more common to express racist views towards Asians. Prior or pre-COVID, this was not an issue. Now, post-COVID, 4 out of 10 adults find it more common to express these views. That's problematic. And in Los Angeles, an organization called Stop AAPI Hate that was started by the Asian Pacific Islander Planning Council, which some of you may be familiar with, have a self-reported line. This is self-reported, and they have had 1,800 independent cases of acts of hate and violence towards Asians that are COVID-19 related. So I just wanted to share this with you because I think it creates the context as health leaders as we move forward, especially health leaders that work with the Asian American, Native Hawaiian, Pacific Islander communities, or work in partnership with the Asian American, Native Hawaiian, Pacific Islander. And while folks may think that this is perhaps somewhat of an exaggeration of what's happening, I do want to share with you a release from the Johns Hopkins School of Public Health. I was sharing with one group of health leaders that this communications came out, and they thought I was joking because they did not think it was we were at the situation. And I shared with them that yes, Johns Hopkins has actually released information and a toolkit in response to how the COVID-19 virus is being framed by political leaders. They came out with this: blame and discrimination attached to COVID-19, and frequently asked questions for US elected leaders and health officials. What can political and health leaders do to prevent stigmatization of people of Asian descent? So I just wanted to share this with you because, as I mentioned before, when I've been talking to different groups, they were in disbelief that this was even necessary. And perhaps I don't need to share this with you as folks that work with our communities and communities of color, that this is unfortunately very, very real. So what I wanted to ask at this time is I'm gonna ask Ellen if we could put up poll number 1. And I'm gonna ask you all just to take a quick poll and just answer candidly to where you think you are as a health advocate and as a community leader. How comfortable are you engaging in conversations about health disparities and health equity? So if you were in a situation, how comfortable are you? How equipped do you think you are? How strong do you think your advocacy skills are about explaining things and framing things? So if you could go ahead and just go ahead and just kind of give us an idea and perhaps reflect upon where you think you are. If you could fill out this poll and go ahead and submit it, and we'll see where the group ranks themselves. Are we getting responses, Ellen?
Yes, I got 24 of 27.
Okay. So the 3 more folks that are out there, go ahead and just, I'm asking everyone on the call to do this. This is a moment to, I think a lot of leadership practices, a lot of them are around reflection and what your thinking is. But let's go ahead and see what the results are, Ellen. We'll see what
Okay.
24 people thought. Okay,
Mm-hmm.
great. 17% folks are very comfortable talking about disparities in health equity, 58% somewhat comfortable, 21% somewhat comfortable, and 4% uncomfortable. And I appreciate people's candor in being perhaps at the stage of uncomfortable or somewhat comfortable, because that's a good thing to recognize. Okay, so we'll just keep that in mind. And thank you for your responses. Okay. I also want to talk to you all about how COVID-19 intersects with the racial justice movement and where Asian American, Native Hawaiian, and Pacific Islanders fit. Naturally, based on the presentations that have been shared and your own lived life experience, I think it's important for us as a diverse community, as Asian Americans, Native Hawaiians, and Pacific Islanders, that we know our own experiences and stories of our own communities. I think this is absolutely critical, that we know about the Asian American experience, we know about the immigration experience, we know about the refugee experience, we know how different communities have different needs and the diversity of our communities. I sometimes will guest present at Asian American Studies courses, and I talk about the Japanese American incarceration during World War II. And I'm actually surprised many times when I talk to groups that people within the Asian American, Native Hawaiian, Pacific Islander community are not even aware that that happened to Japanese Americans. And I will often be asked in disbelief if my families were affected by the incarceration. And for me to share that, yes, my father's family, my mother's family were all, incarcerated, lost their homes and such. And so I think it's important that we know each other's stories and we know each other's experiences. And for example, for me to recognize, I feel much more knowledgeable and comfortable speaking on behalf of the East Asian experience, which would include Japanese, Chinese, Koreans, other groups, but I know far less about the South Asian experience, the Southeast Asian experience, the Native Hawaiian experience, the Pacific Islander experience. I've often been very humbled by learning more about the Pacific Islander community. And as Susan was sharing, the complexity of the political relationships between the United States government and what's gone on in the territories, protectorates, the jurisdictions where people have been profoundly affected due to health disparities because of nuclear testing. That's part of our community, folks. That's part of our community. What do we know about our communities? So I think we need to understand as a diverse community what has been the very unique experiences of our own ethnic and cultural groups. And for us to recognize our own issues of what we have perhaps in between our communities as well, which is something that's hard to talk about and often not talked about in my experience, that take place between the different ethnic groups. And as Susan shared that word cloud of what was important to us, respect, right? We need to respect each other. We need to also respect and understand the history of race in the United States, and understand the experience of the African American experience, of the Latina, Latinx experience, the Native, the First Nation, the tribal experiences. For us to understand that is profound. I do a lot of work in Arizona, and as an intersection of my experience as a Japanese American, I had got permission and was taken by tribal leaders to the Japanese incarceration camps that took place on reservations during World War II in Arizona. Gila River and Poston, the irony is not lost on me that the incarceration of some of my aunts and uncles took place on reservations. So we need to understand too also how these our communities intersect and such. And I'm going to say something and take a risk with you all. And I don't mean for anyone to take offense to this, but I want to take a risk with you. When we talk about the killing of Mr. Floyd, we also have to understand the unique experience of Asian Americans and the African American community, and build relationships and forge partnerships, and understand that there are some bias, misunderstandings, anti-Blackness that takes place as well between our communities. And we need to own that. And we need to understand the historical relationships between the different communities. If we are to forge new partnerships and work together around issues in the racial justice movement, that is really, as I mentioned before, is not new, but is becoming highlighted because of the convergence of a lot of different kinds of events. And also to share with you too, and I wish we had more time to explore this, but also from a political perspective, if we look through at a level of analysis, the Asian American community, not the Native Hawaiian and not the Pacific Islander, but the Asian American community at times has been used as a wedge group. And what I mean by that has been positioned to unfortunately serve as a divisive group between communities and pitted against the African American community or Latino, Latinx community. So we need to be aware of these dynamics that play out on how race relations are a very complex process, but we need to understand how Asian Americans have been used as a divisive wedge community at times. And we've been played, if I may be so candid with you all. And that we as Asian Americans, Native Hawaiians and Pacific Islanders need to advocate for systemic change. We need to build cross-cultural community, cross-racial communities. And solidarity is absolutely critical between our communities. Cross communities and with other communities. And this is something I just want to share with you. There's this group called the Unmasking the Yellow Peril. Not sure if you're aware of them, but they are speaking on how with the African American community, that the Asian American community, our oppressions are connected. They're not the same. The Asian American experience by no means is the same experience as African Americans, but there's an intersection between our communities, and our oppressions are connected to look at how African Americans are disproportionately impacted by COVID, and the connection between the hate crimes that are taking place against Asian Americans. We need to look at this. One thing I just wanted to share with you also, and I realize I'm going a little bit off tangent here, but I just wanted to share a thought with you that really kind of haunts me. A lot of things haunt me these days around the unfortunate killing of Mr. Floyd. But maybe one thing that kind of summarizes for us to kind of think of as a way to look at our experiences as the Asian American community. As George Floyd was killed by the white officer, I'm very haunted by the image of the Hmong, or the Asian American officer that was standing there as a bystander. And I think in many ways that's very telling, and how we have to look at the role of Asian Americans during this racial justice movement, that we don't want to be bystanders and we don't want to collude, that we need to disrupt, we need to interrupt, we need to be in solidarity. So what I'd like to ask now is, can we go to poll number 2, Ellen? I asked you first what your level of comfort was as health leaders talking about health disparities. But here's something that's related to health disparities, and I want you to reflect upon this in all candor. How comfortable are you engaging in conversations about race and racism, to talk about the constructs of race and the inequality and the oppression of groups, and your experience with race and racism, no matter what cultural groups you identify with? But if you could go ahead and respond candidly as what is your level of comfort engaging in these conversations? I think of health disparities as being kind of more academic. And I consider talking about race and racism is more of a community-based, more of kind of a whole person, more of your level of analysis, more of your ability to talk about these issues as well. And if you could also share what your thinking is, and I'm going to check in with Ellen and see where we are. People's level of comfort. And thank you all for responding as well. I don't know if this is what you were expecting to do at this session, so thank you for your level of engagement. And as we're going to be hearing those responses, just to recognize we're in different places. We as individuals, each one of us are in different places in our journey around talking about disparities and talking about race and racism. And this is a great opportunity to reflect. So Ellen, have we gotten a fair amount of responses? Can you go ahead and post that? Okay. So a greater distribution here, 20% saying they're very comfortable, 20% comfortable, 28% comfortable, 36% somewhat comfortable, 12% uncomfortable, 4% very uncomfortable. So for those of you that are perhaps on the middle part of somewhat uncomfortable, I think this is a great opportunity to begin to think about it and learn. Folks that are uncomfortable or very uncomfortable, I think that's a really important thing to recognize. That's a very important thing to recognize. Where are you? Where are we? And folks that rate themselves as comfortable, very comfortable, I think that's great. We can all be teachers. We have information to share. And even no matter how comfortable we are, we also have great opportunities to learn. So I think we need to keep that humility that no matter where we are, that we have opportunities to learn and such. So thank you for that quick response. And I'm just looking at my phone, looking for my time warning of where I am, but I realized I was looking at a text from my mother-in-law that just sent me her Costco list. So I'm sorry for being distracted. And I'm hoping Costco now has toilet paper again, because she is asking for 2 packs, two of those big packs, and I'm very uncomfortable being perceived as a hoarder. So, but I also realize in terms of family dynamics, I need to be responsive to her request. So finally, we talked about the intersection of, or the intersections of where we are with COVID-19. I'm asking you to think of the other second bubble of looking at the racial justice movement. And then the third context for looking at our work around moving health advocacy forward is economic and recession depression. And for us as Asian Americans, Native Hawaiian, Pacific Islanders, or communities that are serving these groups, is that we need to recognize that the McKinsey group did a study, and they showed that Asian businesses are overrepresented in sectors that are hardest hit by COVID-19. You know, in terms of the businesses, and that we disproportionately, I'm assuming, I'm not an economics person, but I'm assuming that's primarily a lot of small mom and pop businesses are getting profoundly impacted. And there's a just disproportional amount of Asian Americans that are overrepresented, I think similar to the Latino community and African American community in high contact essential jobs. So when we look at the economic impact, those Asian American communities are going to be profoundly impacted. And what I wanted to share with you here is the perception of being foreigners or outsiders is that kind of xenophobia. And I'm very concerned that during a time of economic stress is where this anti-immigrant sentiment, and whether you are an immigrant or you are a 5th generation Asian American, I don't think racists make the distinction between whether you are Chinese or Korean or Hmong, or they don't make the distinction between whether you are a new American or a 3rd generation person, that there's this perception of foreignness, of outsidedness, of not belongingness that seems to really pick up during economic stress. That's going to be present. And also to recognize there's also the model minority myth. that people think, and I believe Susan reviewed this too on week 1, is that everything is fine in the Asian American community, that everyone is highly successful. But needless to say, that it is not a monolithic group, and that varieties, if you think back on that first, one of the first slides I showed you of cultural identities, about economic status, educational attainment, all those kinds of things, is that the Asian American, Native Hawaiian, Pacific Islander community actually has the highest group income inequality in the United States, meaning that members of that group of the Asian American, Native Hawaiian, Pacific Islander that are doing well are doing much better than the average income in the United States. And the folks that are not doing well are doing much worse. And that spread in between is the largest of any other racial group in the United States. For those for those of us for us to keep that in mind. Okay, so those are the things that are somewhat converging. I do want to leave you, with this graphic, which is probably you have seen before. Equality is when you're treating everyone the same, regardless of need. We're talking about equity. We're talking about treating people differently, dependent on their need, right? Equality on the left is you're giving everyone the same box, but not everyone can reach the fruit. But equity is looking at and considering that group or community person's need. So we want to look at equity as an approach. And just one more slide before I send you off to break. The APHA, the American Public Health Association, they have said these 6 profound words: racism is a public health crisis. And I think that's the context that we need to look at moving forward in our work. The 3 spheres of influence I showed you, of COVID, of racial justice movement, and of economic inequality, I think all lead to racism as a public health crisis. And these are things that we need to keep in mind in the work that we do. We need to have a greater level of literacy around these issues. It's not only being able to articulate the disparities, the tip of the iceberg that's above the waterline. We need to look under the waterline. And underneath the waterline that results in inequity and racial and different health outcomes and disparities are the institutional practices that are based on race, where there are institutional racist practices. So I'm gonna now send you to break time. I wanted to make sure that you come back in 10 minutes, and I wanted to confess to you, because I feel safe with this group, I ate my snacks out of order, and I have no snacks to eat at week 5. Thank you. Someone who works with a lot of boards of directors, it's really great when you can hear about the incredible things an organization is doing, and you hear that they have a mission and a vision statement. So my compliments. It's great to hear the great work you're doing and how organized things are and such, and your commitment to the Korean community.
Thank you.
That is wonderful. Okay. Well, thank you for coming back. I appreciate that. That's not always the case when I make a presentation. So thank you for coming back. I will say with all humility. Let's move on. I have about 23 minutes with you. Susan and Loretta, I asked my mother-in-law to stop texting me the Costco list, so I will not be distracted when you're giving me the time limits. Okay, just wanted to make sure, because she told me that if they're out of the Costco Kirkland toilet paper, she does not want Charmin. So I just want to let you all know that I know exactly what she needs, and I'm trying to be an attentive son-in-law. So as long as we have all that worked out. All right, so let's go back to sharing screen. I will go back and, oh, I wanted to be sharing full screen with you, not, Well, rather than attempting to do something else, I will just show you this partial screen if you'll bear with me. Because since we don't have Ellen, I can't do the polls. Is that correct? Yeah, okay. All
That's
right.
correct.
All right, so let's move on. I'm going to share with you some leadership practices from Stanford Social Innovation. And I hope Stanford, you know, you all may be familiar with that. It is a academic institution that's located in the Bay Area. And they have been very progressive of talking about leadership practices during COVID-19. And I hope they're able to model all this work because you all heard what Stanford is not doing in fall, right? Stanford is not opening. So first year students will not be on campus. Second year students will not be on campus. Campus will not be open. So I thought it was very interesting to be quoting them. So I'm going to go through this quickly because I'm being mindful of time. Four things that they mentioned were as leadership practices during this very unique time of COVID-19 is keep going, keep moving for all of us as leaders. To imagine a different future, we have to re-examine our fundamental assumptions. We need to keep in mind, and I think this was very nicely illustrated by Sermin and Bongwo, we have to focus on those with the greatest needs. For Korean nurses to be out there for those with the greatest needs, if there's any language barriers, if there's any access issues, if there are different health beliefs around, you know, not talking about cancer. You don't talk about cancer. You don't share you have cancer. We need to focus on those communities and to take evolutionary steps to achieve a revolutionary goal. And I'm going to give you some really quick examples on how to maybe make this less abstract from my life as a independent consultant, as a facilitator, what's happened during COVID. So during March, my work just stopped. There was just no work for 3 months for the quarter of the year. And so I had to recognize I need to keep going, keep moving. And under the first box there, you see, I wrote that I'm an analog kind of guy. And what I mean by that is, I know this may not be relatable to everyone on the call, but I'm an old school hi-fi stereo kind of person. So I listen to LPs, I listen to records, I have tube equipment. So I'm not even talking about digital, I'm talking about non-transistors, non-electronic stuff, electrical stuff. I listen to tubes. So I'm really old school. And what I mean by that is, so as the facilitator, my work was thinking, I need to meet with people in person. I can't facilitate through distance. I'm a high touch person. It's got to be face to face. But I realized by not being able to adapt to move forward, I wasn't going anywhere. I had with my mom, I had the first telehealth appointment. I've never done telehealth before. So, you know, you got to keep going. You got to keep moving. We got to model this as leaders. So to imagine a different future, re-examine fundamental assumptions. I remember being hired to do these maternal child health community forums. And I said, I've always done them in person. There's no way we can gather maternal child health advocates and do this virtually. It's just not possible. It can't be done. And I have learned that I needed to adapt to virtual platforms to be able to continue my work. And I'm thinking all of us have adapted virtually, but we need to think this through in the other work that we provide. We need to re-examine our fundamental assumptions of how to do this work. Otherwise, we're not going to survive in the I'm not sure which term to use, but I'll say the new normal, whatever that may be. Focus on those with the greatest needs. So for example, I still commit to my work as a facilitator to work with the communities that traditionally not reached. And I needed to design how to do online platform work that's much more interactive, that we do small group work. I'm sure many of you have been on Zoom calls or other kinds of platforms where now you're breaking into small groups. We're doing polls. We're doing all sorts of, I've learned how to do jam boards, which means if you were with me in a meeting and I'd be getting your ideas, I'd be putting them on stickies or index cards and putting them up on a wall. So now I've learned how you can virtually do that. Get people's ideas and stick them up like on a sticky board or bulletin board with different colors and such. So if I'm going to reach those with the greatest need to hear their input, how I choose to do my work still matters. I don't want to do a webinar. I want to do work that includes people, that involves people, that engages people. So it's not a passive participation, it's active participation. And I need to hear the voices who are traditionally not heard. That's what's really important for me in my public health work. How do we hear the voices we haven't usually heard? And that's different ways of engaging people. So I still want to focus on those with the greatest needs. And then finally, take evolutionary steps to achieve a revolutionary goal. So I'm thinking if we start here, if I'm looking at maternal child health forums, how could this possibly apply to other people? And this is what I want to share with you really quickly. Have any of you heard of what's called the curb cut effect? And if you could use your reactions, if you can give me a thumbs up, if you've ever heard of what's called the curb cut effect. No, I'm seeing people shaking no. What the heck is Dave talking about? Okay. I learned about the curb cut effect by working with disability advocates. And this is something that I admit as a, able-bodied person, I don't necessarily think of. Well, I should say I'm temporarily able-bodied person. Who knows what's going to happen down the road, or who knows what's going to happen tomorrow. But right now I'm able-bodied. That can change very quickly. The curb cut effect is when disability advocates started in Berkeley, California, and began the process of taking, curbs, and then you make the cut. So curbs are accessible to someone who is in a wheelchair, or someone else that needs any other kind of assistance that can't do that, that high step, okay? So that was a huge win for folks that had mobility issues. Huge, huge win. But the curb cut effect also had a profound impact on people that did deliveries, that were using dollies and carts. It had a huge impact on people that travel and were rolling around a suitcase or a duffel bag. It had a huge effect on parents or guardians or people that are pushing strollers. And so while it was designed to create greater access for people that couldn't do the high step on a curb, the curb cut effect had incredible benefit to other people. Something as simple as that. And that's how I like for you to think as public health leaders. My willingness to understand and grow, to keep moving, to examine a different future, question my assumptions, and to still focus on those with greatest needs. My work with the maternal child health community has made a major effect in terms of what I designed for maternal child health advocates was turned into this wonderful opportunity. That's how now we're including rural communities virtually. This is how we're creating opportunities for the disabled community that may be hearing impaired or sight impaired to participate on these calls. We've been able to get more youth involved because, unfortunately, because of the impact on school opening and such, some students are available and such. So this allowed a greater inclusion of different voices, of unheard voices in our work in public health. So that's why I just wanted to share that with you, is that even though things look perhaps a little bit bleak, we just constantly need to keep moving. I don't think virtual platforms take the place of working in person, but I recognize now as an old analog facilitator that wants that high touch, that wants to bring people into small groups in a room. I want to do group hugs. I want to hold hands at the end of the meeting to show how granola-ish, how Berkeley-ish I am. That's not going to be the future. But I don't have to sacrifice my practices, my tenets of participation and engagement. I can, as much as possible, try to engage that working virtually to work with the communities that are greatest need. So I just share those stories with you because I was really resistant to changing things, very resistant. So we need to be mindful of that. So those are kind of my individual lessons learned from COVID as adapted from the Stanford Social Innovation. But now I'd like you to think kind of on a larger organizational level. And Ellen, if possible, could we bring up poll 3? If that's possible. And I'm looking for
Ellen, yeah, there we go.
There we go. Thanks, Ellen. So
You'll have to scroll down to question number 3.
go to question 3. So I'd like you to think about, in this new environment we're navigating, how everything has changed at your organization. And I'm assuming the organization that you are involved with to be on this call, or the academic institution you're involved with, or the place you volunteer, or your affiliation. Has the organization, has your community engaged in a strategic planning process to respond to COVID-19? Has that happened yet? So if you could go ahead and say yes, no, or for whatever reason it doesn't apply. But have you engaged in a process?
Dave, it looks like because these are all the questions together and Ellen's not here.
Oh, okay.
I couldn't submit my one answer without responding to all the other ones.
Okay.
See, so some people have responded already to number 4 because he couldn't.
We couldn't. Okay. All right. Well, we'll come back to that if we can, and if we cannot, then that's okay too.
Can you see the number 3 result?
We got number 3 results. Okay.
Yes. Yeah. Here is the number 3 result. Just
okay,
let me know when you want.
Oh yeah, go ahead. Go ahead,
4.
Helen. Thank you. Please.
Do the number 4?
No, just number 3, please. Just number 3.
Yeah.
Okay. Number 3, 100% yes.
But that doesn't include everybody. Like I didn't do it because I didn't respond to the other questions.
Okay, so we're not able to get everyone. Okay, that's fine. But I'd like you to think about, independent of this poll, just think about, have you engaged in a strategic planning process on how to respond to COVID? How your organization is going to respond to COVID? Just if you could just think about that. Okay, so let's move forward. So I am going to talk about what I'm calling the R's of organizational COVID-19 impact. We talked about the larger environment, right, earlier this morning: COVID, racial justice, economic impact. I just talked about some leadership practices we need to model as public health leaders. Now I want to talk about your organizational home, how you respond to all these kinds of things in the larger context as an organization. I believe when COVID hit initially, and I'm not sure what the timeline was for Texas, but for California, it was definitely mid-March that I think it really hit home and people began to shelter in place. And I found a lot of organizations that I work with were just reacting, just responding to the situation as they needed to. And when organizations respond to a crisis, the first stage is what I call react and respond. As an organization, you need to take care of your staff. You need to make sure they're safe. You need to make sure your volunteers are safe. You got to make sure your board is safe, right? You don't want anyone to have any kind of unnecessary exposure or take any kind of risks. You protect core organizational operations to make sure you're able to keep your physical door or your virtual door open, that you are not closed, and you are still delivering essential services. You are still reaching out to that, the core community that you are trying to work with. React and respond. It's that natural stage. The challenge for a lot of nonprofit organizations, I would say to you, is there hasn't been a shift out of reacting and responding. And there's not going to be, I believe, in this current environment, a magical green light that things have gone back to the way they were before. I don't think things will go back to the way they were before. And it's kind of like what I'm sure you've all heard this metaphor used before. It's not going to be a light switch that click on, click off, everything. It's going to be more of a dimmer, a gradual things returning to a level of normalcy and then perhaps dialing back when needed and then moving forward. It's not going to be a light switch, a black, white, on, off. So as nonprofits, as well-intentioned, noble, committed people to serving the community, sometimes we're not as organizationally savvy as we need to be because we hunker down in this react and respond, but we don't move forward. So if we had the poll, I would begin to ask you, which stage do you think your organization is in right now? And since we don't have the poll, I'd just like you to just kind of think about that, where your organization is right now. Are you still in that stage of reacting and responding to the current situation? Or are you at the next level of ours, which I call recover and reset? Are you moving forward to beyond that stage of simply figuring out, okay, when things get better, we'll return to normal. But you are seizing the moment, that you are recognizing that in order to move forward in this new environment, that we need to recover and reset. That includes engaging stakeholders, the key folks that you work with in your organization in the strategic planning process, which can include key informant interviews, focus groups, retreats. And right now, I don't think any organization should do a retreat, so I'm calling them advances. But some sort of opportunity to discuss and strategize, or town halls, to be able to hear from, and there'll be a virtual town hall, obviously. I've been doing a lot of virtual town halls for organizations. What are the concerns of the communities you're in service to? What do they need? What do they see for the future? How can a nonprofit organization recover in this situation and reset themselves to revisit what the needs are of the community? What was modeled earlier by the Korean nurses was that we need to talk about vision and mission for your organization. Vision and mission are incredibly important things to an organization. They are your guiding light when things are tough. And let me tell you, things are tough right now. Your organization vision is the impact you want to create. Your mission is your purpose, and your values or your guiding principles are what's going to help you make tough decisions during tough times. You need to be grounded in these, and that may require a revisiting. Just a quick comment that a vision, I want to make sure you all know, is funding independent. A vision is why you get up in the morning. A vision is what your dream is, what the ideal is, why you get up out of bed, now not get into your car and drive to the office, but you get out of your bed, put your sweats on, maybe you do your hair, maybe you don't, but then you go to work in your kitchen, or you go to work at your desk someplace in your where you're living. But the reason why you do that is because you're committed to something that's bigger than just you. A vision is funding independent. It's what your dream is. A mission is your purpose and how you accomplish your vision. And your mission may change based on your resources or the funding that you have available to you. So I want to make sure I make that distinction. A vision is what drives you. It's your dream, it's your passion, it's your ideal to make communities healthier. Your mission may be through cancer screening, but that's going to change if funding is different. So I want to make sure that as an organizational leader, you're absolutely clear on that. And I would strongly recommend in these unique times that you do some sort of assessment of the changing environment. And the traditional one is a SWOT. There's many ways you can do this. A SWOT, for those of you who may not be familiar, is looking at, from your organizational perspective, what are the strengths you have? Recognizing the COVID environment we are in, what are the strengths the organization has that we can continue to build on? Conversely, what are the weaknesses? What are some things that we have to recognize that COVID-19 has impacted, that has exposed a weakness or challenge in our organization? These can be very, very courageous conversations to have, but it's time to do that assessment. So that's the SW. OT for SWOT are opportunities and threats. Strengths and weaknesses are now, in the moment, internally what you're experiencing as an organization. Opportunities and threats are what's outside the organization, future oriented. And though it may be bleak at this time, there are opportunities out there. And for me as a facilitator, the opportunity was to completely switch and work over virtually. And that's what I've had to do. I've had to work with all my organizations like yours to have them recognize the opportunities to continue the work, some of the work they can do virtually. And then threats. What are the things that we don't pay attention to now, we don't recognize, we don't strategically think about and plan for, they're going to impact us. So what are some of the threats that are out there? And I'm assuming that what everyone is thinking about right now And I'm right now shuddering at the conversations I've had with all the big national nonprofits, is that funding is going to go way down. American Cancer Society is really been a huge hit from their corporate donations, their corporate donors. So we would need to recognize that things are going to be very different down the road. State governments are hurting as revenues are down, right? Funds are being redirected towards COVID work, which is important, but it can really take away from some of the other kind of chronic disease or prevention work that we want to do in other areas. I've been told, and this is because you heard from Camille from Appeal, one thought about doing tobacco work, which is still the #1 preventable cause of death in the world. #1 preventable cause of death in the world. And a huge comorbidity is that tying lung health to vaping, looking at respiratory health with COVID. I mean, that may be an opportunity. That's what some people are thinking. But we need to be creative. We need to embrace these things. So we need to get out of react and respond and move into recover and reset, okay? And then to move to finally reimagine and renew. We as leaders need to, based on our work in recover and reset, reaffirm, revise, and realign organizational priorities. It's not business as usual, folks, in the new environment. We may need to realign organizational priorities. And if you don't realign, then we need to reaffirm those priorities and let everyone know that we're sticking to these. That's got to be communicated. You got to have a communications plan. You got to draft a plan to move forward. For you as leaders, you need to create a level of confidence and certainty by articulating what you're going to do to move forward. What are some specific timelines that you can work with that you think are realistic in this unknown environment? And what are your indicators of progress? That's absolutely critical, folks. If you currently have scopes of work or work plans, you need to revise those. If you have a strategic plan, you got to revisit those and reaffirm your organizational priorities and look at different objectives. It is absolutely critical. If you don't do that, I think you're really going to threaten your organizational sustainability. Please don't pretend nothing's going on around you. These things need to be embraced. And then finally, if you all haven't done this yet, you need to initiate conversations with your funders, your donors, your supporters. And whether you are an organization that is funded through donations, through a membership base, you need to talk to them. You need to connect with them. If you are receiving public dollars, city, county, state, fed, you need to talk to your program officers or your contract analysts. And for any of you that are receiving foundation money, talk to those program advisors. Just be in touch with them, just so you're absolutely clear what's happening in this environment. And I'm assuming that perhaps, well, perhaps the council member who spoke to you talked about this too. Don't reach out to people in policy roles or funding roles only when you need something. Even if your funding is safe, your resources are safe, independent of the impact of all this COVID-19, then disconnect with them. Let them know that you're thinking about this. Have those conversations. Have those conversations. So this is what I see as the reality of these R's, that a lot of nonprofits are staying in reacting and responding, being in the moment, which a lot of us do. Nonprofits don't usually have the luxury or the resources to do a lot of planning. So the reacting, responding is far away from the reimagining, renewing, and recovering and resetting. It's seen as separate. I would encourage you that you work towards, and I would have created a better Venn diagram, but my skills are really limited in doing PowerPoint. That should be a much greater intersection. But as nonprofit leaders, we need to embrace the intersection between these three circles of what's happening in our current environment, reacting, responding, what we need to do about recovering and resetting, and then reimagining, renewing. That sweet spot is the intersection of all those three circles. My challenge to you is, the polls we're working, I think most of you would identify where you are. I'm guessing most of you are in the react and respond space, which is separate and too distant from these other two areas. I encourage you through your leadership skills, your leadership advocacy, your role in your organization as a board member, as a staff, as a volunteer, as a concerned person, you encourage leadership to move these three circles together. It's imperative to survive in this new environment. So I realize I'm basically out of time. I'm going to close up with a quote that Susan started you all with on module 1. And that is, of all forms of inequity, injustice in healthcare is the most shocking and inhumane. Reverend Martin Luther King Jr. And I think that's what we need to keep in mind. We need to hold in our hearts, but we need to be larger than the individual roles that we play and think about this large environment that's happening around racial justice, around economic impact, as well as the disparate impact of COVID. And we have to think pragmatically with our organization as a vehicle to address these issues. We need to keep our organizations sustainable. So here's my contact if you want to get a hold of me. I appreciate the gift of your time, and I appreciate having your time and energy for these two sections. And on that note, there may not be time for questions and answers, which is fine, Susan. People can just follow up with me individually because I want you to stay on schedule. I'll turn things back to Susan.
Okay. Thank you, Dave. That was really fascinating. I want to know more about it. I want to take one of your all-day conferences. We're going to move on now to our second community highlight, and that's going to be Wilson Wynn from the University of Hawaii, Manoa.